Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand.
Good morning. Once again, we welcome you to Issues at Hand here on Church of Uganda Family TV. We apologize for that short delay, but here we are. And of course, this morning, the beginning of the month, we want to discuss issues to do with nursing and midwifery students, or the nursing and midwifery fraternity. And of course, with us is Tumwebaze Brian, and of course, later on we shall be joined with Kagogha Sage, who is the president of the Inter-University Nursing and Midwifery Students Association. But of course, let us start off with Brian. Brian, it's a pleasure having you this morning.
Thank you so much.
Good morning.
Good morning.
Yeah, kindly great to have you, and then we should get into our deliberation this morning.
Good morning, our dear viewers out there. Happy new month. My name is Tumwebaze Brian. I'm a year 4 nursing student pursuing Bachelor of Science Nursing at Mackay University.
Okay, so we are looking at basically the challenges faced by the nursing fraternity, and of course starting it from there, probably you can highlight, now that you are year 4, you are a finalist.
Yeah, true.
So someone would really want to know some of the challenges you get into before we get into, of course, the internship, these discrepancies. Of course, there was an issue last year where we had an issue, and of course, I think this was partly because the Ministry of Health wasn't able to take all of you in, but of course, I believe that was sorted. We now wait for your turn when you're going for internship, but we shall get into that. Let's first of all start with your journey of the 4 years.
Okay. My journey of the 4 years, like any other academic journey, it hasn't been a smooth one, I can say, but I'm trying to persevere through the journey. But if I may go through the challenges as a nursing student, you see, most of the nursing program, people, I can say people undermine it. First of all, there is that belief it is a ladies program. As a man, you will get challenges. And
senior 4 leavers.
Yeah, senior 4 leavers. Most of them, they think nursing is. They do actually. Many people are not informed about the bachelor's nursing program. Yeah, most of them, when you say nursing, they think the other senior 4 certificate people.
We also have a mentality that if we see any man in a hospital, there are doctors, and any woman is a nurse. That is a mentality out there within our people.
Actually, that is, to some extent, that is true, because even when we are there in the hospitals, because by year 4, we have gone through majority of the hospital wards, and some people call us doctors on ward, but it's fine. Doesn't matter what they call you, but what matters is what are you doing? Are you doing what you're supposed to do as a nurse? Do you perform your duties as a nurse? Because there are duties that are for the doctor and there are duties for a nurse.
Just before we get into the challenge, before we get in depth of the challenges, probably if you can help us highlight some of the duties and responsibilities of a nurse, so that we know that if I find a Brian in a ward, this is what I should expect out of him.
Okay, thank you so much. Basically, to go through the duties of a nurse. As a nurse, you are in contact with the patient 24 hours. Okay. The time you are on ward, you are supposed to be in close contact with the patient, like giving nursing care. If the doctor prescribes medication for a patient, the patient A is supposed to go under this, receive this, receive this, receive this. As a nurse, it is your responsibility to make sure that if you are on duty, other patients on your ward, have they received everything that the doctors has said, the doctors has jotted down how the patients received everything. Basically, that is the importance of the responsibility of a nurse on ward.
Okay. Yeah. Now getting into the challenges that you were starting to highlight.
Yes. First of all, challenges, like I said, I'm from Mackay University. So for us as nurses in our first 2 years, there's no difference that this is a nursing class, this is a doctor's class, it's a medicine class.
Hey.
Yes, we do general things, year 1, year 2, everyone, doctors, nurses, dental surgeons, pharmacists, we are all in the same class, seated under the same roof, studying the same things. To me, I think maybe at a point they are giving us
more than what
we
you qualify for.
But on the other hand, it is an advantage to us because it puts a difference between some of us from Mackay and maybe other universities which don't go deep into the context of that. But sometimes it is also a challenge because, first of all, the admission criteria for those programs is different. If they're taking, if the best student in the medicine class has 20 points, it is very hard to find someone in nursing class with 20 points. So there is that gap between maybe some people's capabilities.
So do you choose to go for that particular course, or it is fate that pushes you to nursing if you don't qualify for medicine?
Possibly I would say this, and most people out there, even my classmates, would agree with me. Most of us, it is fate that puts us there. Because trust me, people out there in the biology class, in the high schools, their main goal is medicine, maybe any other courses, not nursing. Yeah. But there are some people there who have nursing as their first. But a bigger percentage of the nursing people,
fate.
Maybe at Mackay University, it is fate.
I believe it's the same elsewhere. I don't know.
Possibly it would be.
Okay.
Yeah. But at Mackay, over 75%, it is fate that has put us there. Yeah. But what we have learned is to accept our fate and have passion for the course and move on to serve the people.
Okay. Yes. So still talking about the challenges, of course, what about after the 2 years? Because we've talked about the 2 years where you sit in the same class with the medicine students and all those other disciplines. What about after the 2 years?
And now after the 2 years, that's when we take the different routes. As nurses, you go to your clinical placements as a nurse to do to be taught what a nurse should do. Yeah.
Okay. So don't you find the 4 years a little longer?
Actually, the 4 years, to what I've seen, the 4 years are not enough for this profession, I could say. Actually, it could also be a challenge because you find you're given a rotation. Let's say right now I'm doing my critical care rotations. Critical care is handling people major in ICU, critical ill patients. And you find you're given, like we are given 3 weeks to rotate in that area. And that is very little time to grasp each and every concept in the critical care nursing field.
After your 4 years, do you also take a 1 year of internship, or yours is different?
We do.
Okay.
Yeah, after 4 years, we also take on the 1 year internship period. So,
don't you think that you'll meet most of these details when you go for internship?
I could, possibly I could or I couldn't, because it will depend where you are placed for your internship. Maybe they could put you up country where you will find there are no intensive care units. Maybe some other units don't have. You understand that there's a difference between up country facilities and facilities here in the city.
What's the difference? Someone will do it. Because for us to know, if it's a general hospital, it's a general hospital. If it is a referral, it is a referral. If it is a health center, it is a health center too.
Okay. Like, there's a difference between a general hospital and a referral hospital. You accept that. So that is the gap I'm talking about. If you are placed to the general hospital, maybe I would use... I'm trying to see an example I could use. Maybe, you are placed to... some people are placed to Gombe Hospital. It is a general hospital. Trust me, Gombe Hospital is not at the same level as Mulago National Referral Hospital or Mbara Regional Referral or let's say Mbale Regional Referral Hospital. There are some concepts you won't get. There are some cases you won't get at that level of the general hospital. And if you didn't get enough chance when you were here at Mulago doing your clinical placements as a student to grasp those concepts, trust me, you would have missed those concepts.
But we don't also rule out the fact that you people are many. And so if they say we are giving you a clinical rotation for 2 months, won't it be a disservice to the others?
Actually, as nursing students, we are not that much. In my class, we are only 19 students.
Only 19?
Yes.
So the country needs more of you. Anyway, we are taking a short break, and when we return, we are continuing with with the discussion. It's quite interesting, and of course, this is something new that some of us are getting to know. We are coming back shortly.
Issues at hand. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand.
Welcome back from that commercial break. This is Issues at Hand here on Church of Uganda Family TV. And of course, we are discussing issues to do with the nursing and midwifery students. And of course, when you talk about students, this is students across the country. And of course, before the break, Brian was taking us through some of the challenges. And later we realized that actually the country needs more than what is being admitted as per now. That's specifically for Makerere. She says they're 19 in year 4, and that is quite a little scaring because we need more of them. However, we are joined with the president of the entire University Nursing and Midwifery Students Association, and that is Mr. Kagogha Sage Enock. It's a pleasure having you this morning.
Thank you so much.
Yes. Now, before you came here, we were discussing some of the challenges, but then we're bringing something called the Inter-University Nursing and Midwifery Students Association. So someone really want to understand more about this association, what you do, qualifies to be a member of this association, and the member universities.
Okay.
Yeah.
Yes, thank you so much. Good morning, everyone. The Inter-University Nursing and Midwifery Students Association is basically an association that umbrellas all the bachelor or the degree cadre nurses, most of the students that are pursuing that role as a degree nurse in all the universities in Uganda. And what we do is basically we do some advocacy, we do capacity building for these students. We equip them with the necessary skills to ensure that they become the responsible citizens out there, the responsible nurses that we need. The university is made up of about, the association is made up of about 19 universities. We have the private universities, we have the government universities. For example, IU, Makerere University, UCU, we have Aga Khan, we have Victoria University, we have Bositema University, we have BSU, we have Lira, Muni, Soroti, we have Mbarara. There are quite many, Mountains of the Moon, and to mention but a few. What we do basically is we do advocacy for these students, because we've realized that back in the days when this association was not there, the bachelor nurses didn't have a say in whatever was going on in the country. They were just trained, and then they would just proceed to the professional workplace. And these are the things that are now causing a turmoil in the profession. You realize that there is no person advocating for them. We are now seeing internship discrepancies coming about. We are now seeing a lot of confusion coming about in the country, because the people that were prepared mostly during the university time, when they were still in school training, they never got a chance to go through these kind of leadership structures. And that is what we are trying to bring to the table, to bring up nurses who actually are demanding because nursing has a standard. There are certain standards that we should not go below as nurses. Most of the people think that being a nurse, you're just secondary to a medical doctor, and your say does not matter. Yet that is very that is very wrong, and that is not right. As a nurse, nurses make their own decisions. They make rational decisions, and they take full responsibility of the care of a patient.
Okay, this is quite interesting. How old is this association?
This association is about 3 years now.
Okay.
And it was started by a very wonderful group of people, and about 3 years ago from Victoria University. Then the next leadership went to Muni University last year, where it was launched officially, and the official launch happened at Clark International University. So there is a multi-collaboration between these universities to see that we put this thing to the standard where it belongs.
Okay. So we're still looking at the challenges, and actually you brought in something about internship discrepancies, and of course this was alarming last year. We don't know whether we are expecting to see any issues this year, but of course the ministry came out and gave an answer to why this issue came through. But then this time round, there's also another issue that came about still internship recently. But this time round, I think this doesn't affect you who are direct entrants. Okay. This is for people upgrading to be graduate nurses, and I think internship for them the internship was banned by the Ministry of Health still. So do you believe that with your interventions, some of these things can be addressed before they go out of hand?
Yes, these things can actually be addressed before they get out of hand. And normally, they don't consider us. They don't consult the students, they don't consult the associations, the unions that we have in place. Because you realize that these extensors, actually they were practicing elsewhere, probably at a different level, as different cadres. Let me say, somebody who was doing psychiatry, somebody who was doing a very different thing, is now upgrading to become a bachelor or degree holder nurse. And definitely the scope of practice is different, very different. So how can you deny this person an internship process? How do you deny this person a chance to practice their skills, hands-on skills? Because nursing is a whole lot of package that you cannot just do. You just can't wake up in the morning and say, I'm a nurse. Yes? It just goes beyond the bedside. There is a lot we do to make sure that the patient goes home well, that the patient goes home okay. Yes, so it is more than just dispensing medicines, and these are the skills, these are the necessary skills we equip these people before actually letting them practice as bachelor degree holder nurses.
I'll ask this, I'll send it to Bren. Bren, with all these interventions, do the people you advocate for, are they interested in your advocacy?
Yeah, probably people are interested, because if they are not interested, having introduced this association, people having sold their ideas to the different nurses, if they didn't see value in the ideas of the association, probably this association would have collapsed long time ago. But the fact that every year that comes, we have succession of leadership and new members coming on board. Actually, to inform the public, every year this association holds an event. We have an increase in the participating universities. Giving an example, we usually have our annual quiz challenges, nonsense quiz challenges. 2024, we are at Mackay University. This year we're at Bishop Stewart University in April. But here at Mackay, we had around 7 universities participating. But to my surprise, we had 11 universities participating this year. Meaning people have bought the idea of the association, and they are trying to love what we are doing. And maybe I would urge people there who haven't come on board, they could join us, and we make this move, and we see we can achieve our aims and objectives.
So in joining, do I join as an individual from a different university? All the university should have an association that joins this association?
Okay, it begins with a university having their mother association. Like at Mackay, we have the Mackay University Nursing Students Association, which has been around for over 30 years. Yeah, so it begins with the mother association that comes and subscribes to this national association. Yes.
Well, Enock, still talking about this, when I asked him that people interested in the advocacy, you laughed, but it was intentional. Why? We realized that in the association, you might be doing a lot of work, a lot of advocacy, but then the people you are advocating for will come and say, but did we tell you we are interested in that? Did we tell you that is our voice? Or you sat there as the top leadership and you thought this is what we want. So with all these challenges that are mad in the profession, you have cited out some where you talked about capacity building, where you talked about all that that you do for the people, for the nurses. So someone would really ask themselves, where do you pick at the basis to do all that? Because someone would still look at you as a student and say, you're my fellow student. How do you give me capacity building? I expect capacity building to come from maybe a union or someone from the Ministry of Health to come and spearhead this. Why is it that it is students that are pushing this?
Why is it students pushing this? Well, for anything to be prosperous, there has to be leadership at each and every level.
Okay.
And that is one thing that can show organization. Yes, and at a student level, the leadership at the student-based level opens the students to the necessary resources they need actually to thrive when they become now qualified nurses. For example, just this year alone, as you were saying, that most of the universities were just adding up, trying to subscribe, because each university based association subscribes now to the national association because they see its importance. We have, I think, just this same year, we had an 80-person delegation that went to Rwanda just to represent us in research. Now, these are doors now we are opening for these students, because basically the practice, the policy in Uganda has been students are doing their research and putting it on the shelves. Yeah. After being satisfied, they put it on the shelves, and it is doing a lot of nothing. But now we are opening up for them journals where these students are now publishing this research, and some of them are actually even earning money from it. Yes, and they're publishing this research for free. we are moving them abroad into various countries to represent us. And frankly speaking, we are really having less of the support, more so from the various associations that we have. But I want to give actually credit to Union and AGNMU, because these guys have always come out through for us in times when we need them. They have really been there as mentors. Anytime we have an event, they always source out for the necessary people who can actually provide the capacity building that we are talking about. Yes. So our role as an association, as a national association, we try to open for these students opportunities and try to provide them with the necessary resources to thrive. And during this period, we are in the period of a transition of power, because I'm leaving office, but you see how crazy the applications are coming in, because people are now seeing the importance of the association and they are trying to contest, and this man himself is now contesting for my seat.
Let me hope we are not going to have issues of you reclaiming the seat after.
No. He hasn't tampered with the constitution.
So we are trying to prepare them. We have laid down a constitution, a student-guided constitution. We are trying to provide with them with the necessary resources. Such that, because now, when you look at places like the Ministry of Health, yes, most of those boards that are decision-making have less of the nurses. Why? Because nurses have not been trained to be advocates. They have not been trained to be leaders. Yes, and this route comes down back to what? To the practice. In our curriculum, we have the leadership and management kind of what? Course unit. But now people are not putting those into what? Play. They wait to act in hospitals and all that. But as well in government, in all that, we are dreaming of a country where we shall have a Minister of Health as a nurse. Yes? A Minister of Health as a nurse, a commissioner probably of something, director of something, and they are nurses. But you realize that on that table where they sit inside there and discuss, you may find one or two nurses, and most of them are the doctors, and the nurses don't have a say. Because back in the days, they used to train them that actually nurses keep quiet when doctors are speaking. When they are making a diagnosis, nurses don't speak. They keep quiet and wait for the doctor. But these days, nurses are trained to make their own diagnosis and even challenge the doctor's diagnosis in case it is what? In case it is lacking. So nurses assess a patient, they diagnose the patient and make their own diagnosis and come up with wonderful results. And you will be surprised by what nurses are doing out there. And we have seen 3 cohorts graduate, and some of these students have passed through this association. For example, when you look at Enock Kagogha Females Campus, the current director there, the current director responsible for nursing school happened to pass through this association. And when he starts to tell you the wonderful stories and how the association built them, you'll be surprised. So this is really a wonderful platform, and I urge all universities that have not yet joined us and all stakeholders that need to be part of this movement. I don't know what to call it a movement, but need to be part of this wave. Should join it when it's still young, such that we can actually bring our nursing standards up.
Thank you so much. Of course, other than advocacy and capacity building, we've had an issue of nurses having issues in very many hospitals, and of course, this is sometimes attributed to female nurses who are tough, who are rude, who even sometimes slap others. But also, we've seen some that are being accused of negligence. A patient comes on phone and then they'll first complete their phone call, and I mean, so Bren, do you believe that with the future of this, the intervention and the future of this association, we shall never see that again?
Yeah, probably, I could say. But before I give a say about that, to me, I think that the negligence, the rudeness, it probably roots way back from personality. Who is Brian? Know that it is generally amongst nurses that nurses are rude. I could say that is a stereotype, but that kind of personality, it basically begins on who the person is. Yes. But with the upcoming nurses,
So do you have an intervention with even someone's personality that will damage your profession, the name of your profession?
As an association, the way you come together with people, the more you come together with people, because we often come together not because of academics, but even other social events to bring us together and teach people, and where people learn how to socialize with others. And I think with that we could have tackle that as well, see how someone interacts with the other, and so that there can be a relationship, a good relationship between the patient and the nurse, between the nurse and the nurse, and between the nurse and other professions. Because in healthcare, it is a multidisciplinary role. Different people are playing different roles, and if you want good results as a team, you have to play together. For example, take an instance of a football team. One player cannot make a team better. But because different players come together with the same goal, then you will have a great results. So as a healthcare team, doctors, nurses, surgeons, and different people on wards, when you come together as a team, probably we have good results. That is where the professional relationship comes in. As a nurse, how do you relate with fellow nurses? How do you relate with fellow doctors? How do you relate with
the nagging patients?
How do you relate with the patient? You have to understand the patients you're dealing with. If the patient is...
Some of us are really nagging.
Yeah, if the patient... Okay, sometimes you meet a patient and the patient is... Okay, at times it can be the situation that is putting the patient into that. The patient is under pain, very deep pain. So you have to understand the patient is undergoing pain. Maybe pain is causing each and everything. It's changing the moods, everything. So you have to learn how to handle such patients. You have to learn how to handle patients who are good and patients who feel very rude, so that you can keep that relationship and the patient has trust in you.
Okay.
Yes.
Thank you so much, Enock. We are living in times where your profession is at stake because it has been invaded by impersonators. Someone impersonates to be a nurse. They even find ways of getting a fake license for a facility, and then they start doing your work. What are you going to do about this? Because since you're in advocacy, and this is where it all starts from, that there are a lot of people out there who are not qualified for what they're doing, but they are doing it. And surprisingly, some people say they do the work better than the professionals. I've heard of quite a number of such things happening, where actually people claim that these people actually doing better work. They actually listen to us. A cleaner in the referral hospital is better than a nurse. A cleaner. Now there are places those people can't work. For example, let us say the surgical ward, maybe pediatrics. Those people cannot mix those medicines there. Yes, but when we come outside to these small clinics and all that, and now that is the work of the necessary bodies that come into place to look out for these the licensing and the whatever accepts them to what practice out there. And these regulatory bodies have to come into play to assist us. Because I think on social media, you normally see those flyers moving around, wrong prescriptions, someone prescribes something very different. But that is not just into nursing alone. It is even among the clinical officers, among the pharmacists. People are prescribing things that you don't even understand. You prescribe for someone medicines, 10 antibacterials and all that. For what? Yes? But now that comes back to us. If the training probably at a certificate level, at diploma level is done very well, if a nurse is well equipped and allowed to operate maybe a clinic somewhere outside there, but given the necessary skills required and the necessary time to practice, because now somebody is not getting time to practice in the hospital, they are not even providing the enough resources. Now if Brian goes to maybe a hospital like name it, a hospital in Luero, and there are not enough resources, yes, they will spend a whole year of internship
without actually acquiring
In the
anything.
sub-county where I come from, where there is only a health center too.
Where there's only a health center too. When will he practice the skills he's supposed to? And this comes back to the government as well. Please put the necessary equipment that will enable us to what? To operate in those places. How will you expect me to operate on you when I don't have the necessary PPEs to protect me, personal protective equipment? Yes. So we are now forcing the nurses to work outside their scope of practice, to work outside the limitations, because they have to protect themselves. That is number one. They have to protect you as well. That is why now the whole health facility is in a state of wagamaya. And one thing I want to say is the health system in Uganda, or the health system wherever in the world, the backbone is nursing. Once you don't provide what is necessary for a nurse to operate, for a nurse to perform and operate at their best, yes, you're going to frustrate the whole health system. And that is what is happening right now. They are frustrating the whole health system. That is why people are now doing what they want. You talked about of a nurse being very paranoid at work. They respond the way they want. That is because of burnout. Simple as that. One nurse is attending to 50 patients. Yet actually the practice says a ratio of 1:1. One nurse to one patient. One doctor to one patient.
But we also can't rule out the fact that we have scarcity in the country, so that might not happen.
Scarcity of nurses? Are you sure?
In hospitals, that's what we see.
We have the scarcity of nurses in hospitals, but the nurses are not being deployed.
Where are they? Those that are not deployed.
But they graduate every year.
But their class has only 19. And if the 19 graduate, and maybe some other university also relates some 15, will that still reach up the ratio?
Now, Mook still has the idea of creme de la creme. But when you go, when you go to universities like Muni, those people have numbers. You'll find a class of 60 students. You'll find a class of 50 when you go to Lira, when you go to Soroti. Those people have the numbers. BSU, down there in Mbarara. Those people have the numbers. You go to Mbarara, you come to IU here where I am, Islamic University in Uganda, Chibuli. You'll find we have the numbers. Yes, because now the people just the year ones who have come in, they're about 100 something.
But we can also rule out the fact that all the 100 might not reach the fourth year. Well, we are getting closer to the end of this discussion. Brian, kindly give us your closing remarks. And I'm told you, when are you voting?
Voting is this month on 20th of September.
Hey.
Yes.
Let me hope you're ready at the guard so that they don't steal your vote.
I'm all eyes open.
Okay. Yes. Kindly give us your closing remarks.
Okay, as we come to the end of this show, we thank you for having given us this opportunity to talk to the people out there and share about what the nursing practice is. As I give my ending remarks, first of all, I would like to thank the Inter-University Nursing Students Association for giving us an opportunity as students to see our capabilities in leadership and in everything we are doing. I also thank the other associations, the Association of Graduate Nurses and Midwives in Uganda, the Uganda Nurses and Midwifery Union, for they have brought our ideas as an association and they have pushed us to be the better version of ourselves as an association. I will also call upon the Ministry of Health to look into the deployment of the upgrading nurses, because they also need that internship period as we directs do need it. They also equally need it and they deserve it so that they can improve on their scope of practice and their skills throughout that year of internship. Out there, as I conclude, I will seek the students out there, the nursing and midwifery students in the various universities under our association to stand behind me as I seek this position of the presidents of the association, so that we can push further. As we are saying, for us, our goal is building bridges between the students and other associations as we inspire the professional growth of the nurses and the midwives in Uganda. Thank you so much. Have a nice day.
And we wish you the best.
Thank you so much.
Well, Enock, your closing remarks.
Yes, my closing remarks, as the president, Inter-University Nursing and Midwifery Students Association, my cabinet 2024-2025, we have done our best. And it is time now we hand over to the coming regime. But we call out to all the people that, all the stakeholders, all the organizations we can partner with. We have seen what they are doing in Rwanda, we have seen what they are doing in Kenya, various organizations in Uganda that support the work of nurses and believe that nurses can actually be helped to achieve their full, to work at their highest level, to come out and assist us in the endeavors that we are doing. We thank Ministry of Health for the good work they are doing. We thank Union, we thank AGNMU, we thank Little Winnie Foundation, but as well Council. This is a call out to the students who are still frustrated because they have not been registered. Those who did the HEC program, please let us also consider those students because they are under NCHE. And I call out all the universities as we're having our General Assembly on the 29th of September, on the 19th of September and 20th of September. Please support those students, let them come and vote the next leadership. Let them come and fight for their profession because at the end of the day, there will be the same people complaining tomorrow. So allow them come and exercise their rights, allow them to come and participate in this wonderful association, and we can see that we elevate and put the bar of nursing up high. Thank you.
Thank you so much, Enock, and to your viewer, thank you so much. You who studied with us, and you've worked at this journey way back from 6:30 up to now. We've come to the end of Issues at Hand, and of course, we've worked with Liz, Esther, Muhumza, Patience, Hope, who were with here since morning, and of course, from the entire team, wish you a blessed day.
Issues at Hand